Yes, we are a go. We have started recording and we start now. Good evening, everybody, and thank you for joining us on today's edition of our online fertility seminar from Love Foundation. I am your regular host, Dr. Love, or Dr. Ojeze. So we welcome you. Thank you for being here. Okay, so today we are looking at things to know before going for IVF, the lecture series. Yesterday, we just talked around IVF as a procedure, when people should go for IVF, and what to expect partially. We just talked around it like that. And we encourage people to see it as a normal procedure that aids fertility challenges. Okay, so those are the things we talked about yesterday. And today we want to look at the things you need to know. The things you need to know before even beginning the procedure, before starting it. Things you need to do and put in place to ensure that you have success. Welcome, Rachel. Thank you for joining us again today. Welcome. So we'll just get right to it because we don't have a lot of time. I'm going to try to do something new today. I'm going to be voice recording because we noticed that we don't have a lot of people joining on the live presentations. So today we're going to try to voice record and see how those on WhatsApp can also benefit. So welcome everybody. Good evening, everybody. We are here live in our meeting room discussing things to know before going for IVF. We welcome all our followers that are on the WhatsApp platform, those that have not been able to join us directly in the live meeting. You just hear the voice notes and probably later get to see the slides to go through them. But hopefully with this, you'll be able to still get first-hand information, what we are saying. And then eventually, we will also have the recording posted on the group, so on our YouTube channel, so you can also watch it after now. So welcome. We'll get right to it, like I said. Okay, so before we get to the things to know, we'll just do a few definitions so that we understand better what our topic is about. What is IVF? IVF, which means in vitro fertilization, is a process of fertilization. I want us to stop there. It is just a process of fertilization. It is not a robotic way of getting pregnant, no. It is just a process by which fertilization is achieved. But in this process, eggs are combined with sperm in vitro, which means outside the body. That's just all this IVF hullabaloo is about. IVF is just simply that fertilization occurs, but it is outside the body. That's all. It is outside the body. That's all. It's nothing to be, how do I put it, to be uncomfortable about, because a lot of people are so uncomfortable about the thinking even of IVF as a whole. They are so concerned about it, what it means. Oh, is this a normal thing? We talked about that yesterday. It's a normal thing. It's a normal process. It's a normal process. It's a normal process. I can't say that enough. All that happens is that fertilization occurs outside the body. The eggs are taken outside, the sperm of the man is taken outside, and then this fertilization happens in the laboratory. Okay, so the ovulatory process is stimulated in the woman, eggs are removed, sperm is taken from the man, fertilized in a culture, and then when this has happened, the baby, which is the embryo formed, is now transferred back into the body. That's what IVF is. So when this happens inside the body naturally, as in unassisted conception, we call it in vivo. That means that's the unassisted process of fertilization, where actual intercourse takes place, and then the man deposits the sperm cells inside the woman, and the woman, having ovulated, now has the eggs fertilized. That is the normal in vivo process, which is the unassisted fertilization stroke conception. But in vitro fertilization, there is assistance. That's all. That's all. Assistance is given to the couple, helping them to achieve this conception outside the body. Okay, in a laboratory, in a petri dish, that baby is formed and then transferred back into the woman's womb. So we need to understand that, so that we stop having biases concerning the IVF. So next, what are the indications for IVF? Why will somebody decide to do IVF? We are saying here that there are a few conditions that serve as indicators for IVF. They can be absolute indicators or partial indicators. Absolute indicators means when you see these things, there is no other way than to do IVF. That's what it means. When we say these are absolute indicators, it means that once these conditions are present, there is no other way than to do IVF. One of them, we have 7 of them here. Number 1 is blocked or damaged fallopian tubes. If you remember the process of getting pregnant, the eggs have to pass through from the ovary through the tubes, okay, into the womb, and the fertilization occurs at the tubes. So when those tubes are now blocked or damaged, then that cannot happen on its own, and we would need to help the eggs by bringing them out of the ovary directly and then fertilizing them outside the body and transferring them. So you just totally boycott the tubes, and then pregnancy can still take place. Another absolute indicator is when we have low egg reserve. So the woman is approaching menopause, the eggs are small, we don't trust their ability to go through ovulation properly. We can try to extract those remaining eggs, do IVF, and help the woman to get pregnant. Then we have unexplained infertility. We don't know why this couple have not gotten pregnant. We have done everything that there is to do, and it seems not to be working. What can happen at that stage is IVF. We can just give it a try to see whether they will be lucky to achieve pregnancy. So unexplained infertility is a reason also for IVF. Unexplained infertility being that a couple have gone for various kinds of fertility treatments. They have maybe have a diagnosis or not, but they have tried several other fertility treatments and they did not work. So in that case, we'll say, okay, let's give IVF a try and see if that would work for the couple. So unexplained infertility is one of the reasons for IVF as an absolute indication. Then we have advanced maternal age. Of course, if a woman has gotten to menopause, there is no way she can get pregnant by herself. We explained this when we're talking about preparing, that is, healthy egg for pregnancy. When we dealt with that topic, I think that was in May. So, or in April, one of those 2 months. When a woman has reached menopause, her eggs have finished. So there is no way fertilization can take place inside of that woman anymore. She doesn't have eggs anymore. So if she doesn't have eggs, what we can do is to get donor eggs and then fertilize those donor eggs with her husband's sperm outside the body and transfer it into her own womb when the womb has been prepared. Okay, when the womb has been medically prepared, she can have implantation and can still get pregnant without using her own eggs because her eggs have finished. Then if we have genetic disorders, There is even a new advancement in medicine now, what we are calling the mitochondrial baby, where people who have genetic diseases can avoid transferring that genetic disease to their offspring. Okay, so what is that? The genes that causes disease is removed from either the man's, usually from the mother anyway, the possibility of forming that disease, the factor is removed from the woman's egg. So what happens is that maybe you get a donor egg. It's a very technical process. Get a donor egg, transfer the mother's nucleus into that donor egg, remove the donor's nucleus, but leave the mitochondria. Mitochondria is like the energy house of the cell, and then fertilize with the sperm and, have the embryo before transferring to the mother or the surrogate or whatever the situation will be. But it is one of the ways that we can prevent genetic diseases. Okay, genetic diseases are largely inherited diseases. So to prevent that genetic disease transferring to the next generation or to the offspring, you can do IVF, and either if the disease is going to come from the man, use donor sperm. In that case, you need to do IVF. Or if it's coming from the mother, you use donor egg. The woman can still get pregnant with the husband's sperm, but without being able to transfer the disease to the child. So that's for genetic disorders. Then we have previous tubal ligation for whatever reason. Maybe a woman in a previous marriage felt she had completed her family size, and then maybe for some reason is remarrying, and she had tubal ligation in the previous marriage, having completed her family size, maybe after agreeing with her partner, and for some reason is remarrying. The tubes are already tied. Once the tubes are ligated, they cannot be reversed. It usually cannot be reversed. So in that case, the woman can say, oh, I still want to have a child in this new marriage, and then we'll opt for IVF. Or if there was, for some reason, tubal ligation was done, maybe following any medical procedure for whatever reason, she can now decide to do IVF. Sometimes tubal ligation as an extreme procedure is done for some medical cases. So maybe somebody is undergoing some kind of treatment, they don't want any chance of pregnancy, and maybe the person cannot take contraceptive drugs, maybe something like the treatment of cancer or something like that. They don't want pregnancy at all. They can ligate the tubes, prevent other chemical contraception. The woman is sterilized by ligating her tubes, and then she's unable to get pregnant by herself. For such a case, anytime she's now ready to get pregnant, she would need to go through IVF. The final absolute indicator is for azoospermia. Azoospermia is a situation where the man has no sperm cells in the semen. When semen is produced, no sperm cells at all. So in that case, we'll need a donor sperm. Okay, and then that donor sperm is used to fertilize the woman's eggs, and then the eggs can now be, and the embryo, when they've developed, can now be transferred into the woman's womb. So these are absolute indicators for IVF. Okay, so we continue. I had to pause the voice recording so that it doesn't get too long. So we'll continue. So we want to look at partial. So we want to look at partial indicators now. We have talked about absolute indicators, those reasons that once they are present, somebody has to do IVF to get pregnant. Now, the partial indicators are some of those factors where it's not compulsory that it is going to lead to IVF, but we just decided to just go for IVF to make it easier, maybe as a result of one or two other factors in addition to these. Okay, so number one on the list is male factor infertility. If somebody has oligospermia to a very low degree, and it's not responding to treatment, you treat and treat, it's not responding, they might decide to just isolate the stem cells, and then for that reason they will have to do an IVF, because an IUI might not also work because of the low sperm count. So they will now choose IVF for that kind of case. So depending on the case, you want to look at how to achieve pregnancy in the earliest possible way. Maybe the woman's age is also coming up, and we don't want to just spend so much time treating, decide to do IVF. In the case of endometriosis, some people might just decide that, okay, because of endometrial tissues growing outside the womb, things like maybe along the fallopian tubes or around the ovary, making it difficult for unassisted conception to take place, they might decide to just do IVF. If they decide to treat the endometriosis, it's possible to treat it and eventually get pregnant. It might take some time, okay? But if they just don't want to go through all of that, they might, and there's also no guarantee that this would work, they might decide to just do IVF and see if they will get a better chance at that. Number 3 on the list is ovulation disorders. So a woman is not ovulating properly, okay? And she has been treated, or for some reason she cannot have ovarian stimulation. Maybe she already has cysts or things like PCOS. It's becoming difficult to stimulate the ovary, and then she has, tried other methods which didn't work. She might now decide, or the couple together might decide that they want to go for IVF. So that's another partial indicator. They could wait and treat the ovulation disorder, but they might decide to just go ahead and do IVF and save themselves some time. Number 4 is couple's decision. We were talking yesterday about a celebrity that just decided on her own for no reason other than she just doesn't want to go through pregnancy to do IVF, and in that case, choose surrogacy. So it's also possible that a couple might just say, no, we can't be waiting to get pregnant. It will be difficult for us. Yesterday, we gave a very good example. You have a couple, the man walks outside the country, comes home, stays 3 weeks, stays at work for 3 months before coming back. That is a very difficult way to get pregnant. We defined infertility as the inability for a couple to conceive after 1 year of trying, 12 months of staying together. So once that definition cannot even be achieved, we don't even know what to do, okay? Because you have not tried for long enough. The man cannot probably stop his work. Probably the woman cannot join him where he is because it's work, and he only comes at certain times in the year. Maybe in the year, he can come home like 4 or 5 times. There's no way the woman can get pregnant like that. For some people, it's possible, yes. For some people, he comes once, they get pregnant, he goes back after delivering, that's life. But there are in some cases where that cannot just happen. And in such cases, they can just decide to opt for IVF, which is a very good decision to save them waiting years of just trying once in 3 months, once in 6 months, with all the tension and pressure that comes with. So they might just decide to go for IVF, and they will be encouraged to do that. Underlying medical conditions. So like I said before, there are some situations where somebody cannot get pregnant unassisted. If that is the situation, they might need to have procedures like IVF. Like if we have a man having retrograde ejaculation, the problem is not that there is no sperm, it's just that it's not able to be produced to get to the woman and achieve pregnancy. So there might be some blockages here and there also for the man. In the woman, there might be some situations where it becomes very challenging to have to have unassisted conception. So they could decide to wait and go through all the process, maybe corrective surgery and things like that. But if they don't want to do that, they can just decide that let's just go this way and achieve pregnancy, do our best to see if we can achieve pregnancy. Then finally, under the partial indicators, we have surrogacy. Surrogacy, we already know what surrogacy is, where a third party helps a couple to carry the pregnancy, and after delivery, hands over the baby to the genetic parents. So if surrogacy has been chosen as a process or as a pathway to parenthood, of course, IVF must be the procedure to achieve that. So I hope this is clear. So we want to look at things to know before IVF. So we have just done a background introduction, as it were, okay, to the topic. I want to see a few things to note before talking about the main thing we want to discuss. Things to know before IVF. This is so important. It's important to understand these tips, as it were, because this is the bedrock for achieving success in the procedure. We already know, everybody already knows that IVF is not 100% guaranteed. We are going to look at the reasons at the end of our seminar today. But we want to look at the things that you can do to maximize the possibility of achieving success. What are the things you need to know? And when you have known these things, do before even going for the procedure. Because it's not just about going for IVF. Oh, I have decided I want to do IVF, and you just jump into it. You might jump in and jump out because there are factors that must be in place to give you a fighting edge for success. That's just the point we are trying to make in this month's seminar. There are things you must know and put in place before going for the IVF procedure so that you can have a chance at having success. Yes, there are facilities that will tell you that, oh, their success rate is 80%, their success rate is 70, 75%, but everybody knows that that 30% can be anybody, that 20% can be anybody. What can you do as an individual? What can you do as a couple to ensure that you fall into that 80% that achieves success? Okay, what are your own responsibilities? What do you need to know and do before achieving success? These are the things we want to talk about. So just go with me. Before deciding to opt for IVF for fertility treatment, there are a few things a couple of patients must understand. These points serve as crucial factors that can contribute to the success or failure of the procedure. So we're going to look at 4 major factors. Okay, follow me. There are 4 major factors that you must know before going for the procedure. And when you know them and appropriate them properly, you are likely to get success in the process. So number 1 is understanding the process. It is imperative to understand the IVF process, the timelines, what to expect at every given point in time. This is important because it automatically takes away anxiety and surprises, which we don't need when we are going through this process of IVF. Okay? Your emotions are so delicate at that point already, the hormonal drugs and everything. You don't need anything that will just trigger you or take you off the edge. So the best way to combat that is to understand everything step by step, what to expect, no surprises. And this should be done before beginning the process. How can you do this? You can read up information. You can go for counseling to get information from the facility or from those who know more. You are attending this lecture now. You are learning from this, the things that you need to know, the step-by-step of the process and how to go about it. This automatically just prepares you and equips you for the various stages of the procedure. Okay, so let's just quickly look at those stages since we are already having the lecture. Let's look at the stages of IVF. The first stage is the consultation. Here, you get to the hospital or the facility, discuss the process. They'll talk to you about the timelines. You can see that I'm not telling you that IVF takes 6 weeks, or IVF takes 2 months, or IVF takes 1 month. That would be wrong information. Because per case, every case is unique in its own approach. On the average, all things being equal, IVF should take about 6 weeks, okay? But we cannot make that the rule of thumb because per case, per couple, situations can change. So when you have your consultation, they will tell you that these are the things you are supposed to expect. These are the timelines for this step and that step. When you discuss with your medical team, they will tell you everything you need to know, and you yourself need to be as open as possible. Don't give your doctor or your medical team any surprises as well. Let them know everything so that they can plan with you properly. If there are things that you are already doing that can jeopardize the process, it's important to let them know so that they can know how to time your own procedure. So that consultation is the first step, and it's very important. Somebody was asking yesterday that, oh, is IVF different from fertility treatment? Yes, it is at consultation we will know whether you will need IVF or not. And when we have decided that you need IVF, everything should be spelled out. The second stage for IVF process is fertility testing. Now, under fertility testing, you'll be referred to various investigations as a result of what you have discussed under consultation. There are some tests they might want to do, and the results of those tests will now determine the best approach to your unique care. When they run tests, there might be need for interventions. What does that mean? It means that some results might indicate need for some treatment. So, example now, they can run tests and see that there are certain hormones that are out of place. They might want to first of all take care of that before continuing. They might see that there is infection in place and they want to clear that before continuing the procedure. They might see that there are some obstructions, like in the woman now, there might be fibroids, and they will need to say, oh, we will pause this procedure, go and take out this fibroid and come back. So depending on what the results reveals, that will determine the best approach to the patient's care or to the couple's care. The man might have very low sperm count, and they might say, okay, take some time, boost the sperm, okay, so that we can get healthy sperm to use for the procedure. If there might be azoospermia, and then the plan changes that, okay, we can no longer use this man, we will need a donor. They might check the woman, AMH might be very low, ovarian reserve is poor at its minimal, and they say, oh, we cannot use this woman's eggs, we need to get donor eggs. Everything will be revealed after the testing. So that's a very crucial part of the procedure, and you should not short over guys, what is it called? Boycott it, okay, or shortcut it. Do every investigation you are asked to do. When the doctor says, oh, repeat this, please gladly repeat it. Don't say, I just did it 6 months ago, I don't have money for this one, doctor, please let me just leave this one. They might say, okay, but it is not necessarily for your own good. Okay, so that's that. Sorry, I skipped. So that's that about understanding your fertility testing. The third stage is medication instruction and monitoring. They will give you a set of drugs after the tests. If there are no need for interventions, the next thing is to start your medications. They start telling you, oh, this is how you should take these drugs. Some drugs are subcutaneous drugs, so you have to inject yourself with them. Some of them come like patches. I think in the West, they are moving from that injectables to patches. So whatever the medication comes as, they will tell you what to do. Some are tablets. They have specific times that you have to take them, you know. Make sure you understand what the doctor is saying. Ask questions. Never be tired or embarrassed to ask questions. If they are telling you you have to take this one 2 times a day at 8 a.m. and 8 p.m., if you don't understand, please ask. Because it is too important to follow this schedule that is given to you. It is too important. It's not something that you can shortchange. You can't say, oh, it doesn't matter after all I took yesterday. You can't do that. You're already spending a lot of money. You have to do due diligence to the process. Okay. So after taking your medication, they will tell you to come in for scheduled appointments for monitoring, see whether the ovary is producing the eggs, if the follicles are maturing, all those things. So you have to be intentional about following through. All these things are time-based. So you have to create time. Like if you are working, you have to find a way to get time off work and all of that. So you see that it's not a procedure that you want to do and then you are hiding it. That would be a difficult thing. You must let somebody know, even if it's not the entire company, okay, or the entire department. You must let HR know, and they will understand that from this time to this time, every day you need to close by 2 because you are going to hospital. Whether you're taking it out of your pay or whatever, plan and prepare for it. Don't decide to be sneaking out, because if you're doing that, it might choke you at a point. You can't meet up, and then you skip 1 or 2 things and think it doesn't matter. Maybe you use prayer to cover it. It will not, that will not work. So you have to create time for it, plan properly, and follow through with every instruction that you are giving for your medication and for the monitoring. The 4th stage is the egg retrieval and embryo transfer. So after all the medications and all the monitoring, there will be a day for egg retrieval. The egg is removed from the woman's body. Now, it is now placed in a petri dish, and then the sperm cells, which have been prepared also from the man, is injected or introduced into the petri dish as well. We allow it for some time, and then the sperm cells, which are the most active ones from the man's semen, will now fertilize the eggs. Usually when egg is retrieved, it's not just 1 egg that is retrieved. They might retrieve up to 10 eggs, depending on how many is gotten following the medication. The medication is basically to prepare the uterus and then to cause the eggs to mature and follicles to mature so that they can be harvested. So usually they might harvest 5, 6, 7 eggs, even up to 10, depending on how many they can get following the medications. So when they get the eggs, they will pour the sperm into them, and then they will wait for the embryos to form. When the embryos form, okay, when the embryos have now formed, they will give it some days to mature. So usually within a week, they would have been able to see the maturity of the embryos. The best 3 embryos, they are graded. The embryos are graded grade A, grade B, grade C. Now, that is depending on how well they are developing. The best 3 embryos are selected for transfer. Usually, facilities usually will not transfer more than 3 embryos. The reason is because there is even a possibility of 1 embryo splitting and becoming twins. So if that happens, the person might end up with 6 babies. So they don't want to put more than 3 because of that kind of situation. But sometimes, many times, as a matter of fact, you don't have the eggs dividing. Sometimes you don't even have all 3 taken. Sometimes only 2 will implant. Sometimes only 1 will implant. And unfortunately, sometimes none of them will implant. Okay, so this egg retrieval and the embryo transfer is the 4th stage, which is the final stage of the IVF procedure itself. After that comes the 2 weeks wait. This, the almighty 2-week wait, which is such a delicate time for every couple. You are waiting, you are anxious, you don't know what the result is, you don't know whether pregnancy has taken place, you know, all of that is just happening in your mind. Everybody is like, waiting. There are tips that you can use to go through these 2 weeks without having too much pressure. It can be very, 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 very stressful if you do not manage it properly. Okay? So if you do not manage it properly, it can be very, very stressful. How you can manage it is what we have showcased here. All right, to manage the 2 weeks wait, you can, number 1, we said it yesterday, know that you have done your best and that the rest is in God's hands. When you know the rest is in God's hands, it is to talk to God. You know that you have come this far. God should take control and bless your efforts and help you at that stage. That's the stage to exercise your faith, to trust in God, to show your trust, and to hope for the best. Then you dwell on positive thoughts and create only positive energy around you. The way to do that is to think positive things and declare positive affirmations to yourself and to your baby. You already have a baby. Before what they transfer into your womb is no longer an egg, it is a baby. You have to understand that. Once the sperm and the egg have joined together, a baby has been formed. When they are doing transfer, the babies are being transferred into the womb. So you can speak to them at that stage, whether they have implanted or not. Start speaking to them. Start thinking about them. Okay, declare positive words to yourself. Declare positive words to your baby. Think positive things. Maintain a positive energy. Then you can go ahead to meditate on God's promises to you for fruitfulness and fertility. Whether you're a Christian or a Muslim, that plays out. Okay, I believe. So meditate on God's promises to you. That helps you to stay focused on positive affirmations, because a lot of funny thoughts will be coming to you, you know, and imaginations, fear, anxieties. What if this thing fails? What if? What you can do is to focus on the promises that God has made to you and expect the best. Then, of course, you can't be meditating all day. You can distract yourself with other things in your spare time, with self-care practices. Go for, take a bath, you know, watch movies, have a vacation if it's possible. If you cannot travel, have a staycation. So take some time off work. You know, that 2 weeks is not when you want to be stressing yourself with your work activities. After all your medication and all those things, you can just take 2 weeks. Okay, if you are working. If you're not working, great. You stay home and fill your activity, your day with activities. Read books, okay? Engage in things that will make you happy. Invite people that will care for you, you know, stay with you so that you're not under any kind of stress. People that will stay and be gisting with you, telling you nice things, you know. Just find activities that make you happy to fill up the time. And before you know it, it's night to sleep and all of that. Okay, so that's the 5th step. And then the final step is the post-procedure testing. That is when we'll call the results. You go to the clinic or by yourself after the 2 weeks, you run the investigation, either by using a urine strip or you go to the hospital for a blood test to be sure and to avoid anxiety, and then we see the result. If it is positive, glory to God, congratulations. If that very procedure is not positive, that procedure failed, but it doesn't mean that you have failed. It's important to mention this because there are a lot of people whose minds are so fixated, and we'll talk about it as we move, so fixated on one thing that once it's not exactly what they were expecting, everything just goes south. They lose hope, they get tired and frustrated and discouraged. They don't try again. I've come across a couple. They were trying to adopt. And the reason why they had gotten to adoption was that they did IVF 10 years ago, believing that it would succeed. They put all their faith into it and it failed. And they were so broken, they were so shattered that they decided not to try anything again. And 10 years after, they are trying to adopt because, of course, time has gone, as it were. So expect the best. Work towards the best. But if that particular procedure doesn't come out pregnancy test positive, it doesn't mean you have failed. It doesn't mean your body has failed. It just means something went wrong somewhere and you can do it again and get it right. This is important to note. You can do it again and get it right. And this time with a positive outlook. So we are continuing with things to know. We said, you know, we are at number 1, understanding the process. So we've talked about understanding the process. We talked about the 6 stages of IVF. Number 2 is understanding the cost. It's important to know what the total cost of the procedure is. When you go to some hospitals, because they want you to come to them, it will seem as if their own procedure is cheap. They can tell you, oh, it's XYZ amount of money, and you're like, oh wow, it's not so bad. And then you start. And when you start, you realize that there are some things that you were not told. Okay, some people just tell you the cost for the procedure itself, and they don't tell you the cost for the drugs. They don't tell you the cost for the test. And when that happens, you find out that you still have a lot of money to spend. So if you do not plan properly, you will be in trouble at that point. Okay, so it is encouraged. It is encouraged that as much as possible, you get all the cost. Ask all the questions you can ask. Let them explain to you step by step and what each step costs. There is no point being in denial. Get the total cost for everything from beginning to the end. Even ask for the cost of the post-procedure medications. Because usually, even for facilities that will give you an all-inclusive cost, the cost ends at the end of the procedure because they don't know what the procedure will be, whether it will be positive or negative. So if you have a positive result, as in pregnancy has happened, then you can plan for the post-procedure medications. That's a must. You have to be on some medications to help establish the pregnancy. We continue. Next step is proper communication. Establish a clear communication line with your medical team. Find out who should tell you what, who you should meet for what, just for different scenarios, know who you can talk to. There's a department for cost, there's a department for drugs, there's a department for procedure, there's somebody to talk to when you don't feel things are going well, Find out who you should talk to at what point in time and know that you are doing the right thing. I encourage people, make sure you have an external person that you are talking to, somebody outside of your medical team, maybe your counselor, somebody who has gone through the procedure before that has a positive mindset, not somebody who will tell you only negative things about it. Okay, so always have somebody to communicate with so that you are ready for any possibility. So that's the third thing to know before IVF. The fourth thing to know, which is our major interest today, know how to optimize your chances for success. So before beginning the IVF process, you must understand that the end result, should everything go well, is pregnancy. You are doing this process to get pregnant. Funny enough, you will not believe that after the procedure, some people get pregnant and they're like, oh, wow, okay, I'm not pregnant. So what do I do? What do I do? And they have another anxiety of, oh, what do I do? Oh, what do I do? At that point, can you imagine? It really happens. It really happens. So it's important to prepare your mindset for pregnancy. Prepare your body for pregnancy. If you understand this, you will know that, oh, you are working towards getting pregnant. So you should prepare not just for the IVF steps, but for the pregnancy itself. Now, to prepare for pregnancy is to prepare for a successful procedure. If you are so fixated on the procedure, you will not prepare for pregnancy. And the likelihood of failing will be large. But if you know that this is just a step, what I'm preparing for is actually to get pregnant, it will help you to prepare better. Now, there are three major steps to prepare or to use in optimizing your chance of succeeding. And they are: number one, plan adequately. You should never rush IVF. Take your time to plan, from how you will take time off work, to how you will choose the right clinic, to how you will cover the costs pre and post procedure. Take all the time. It's better you go and hit it once. Never be pressured into IVF. Never be pressured into IVF. Let not the pressures from society be what will make you say, let me just do this IVF, let me just rest, so that at least maybe God will help me and I will just get pregnant and all this wahala will just come to an end. Never be pressured into IVF, because that is already a formula for failure. So prepare adequately. All you need to do, all you need to know, put everything in place, then you can start. All right? 2, which is the most important point, prepare the body. It is the body that will get pregnant. It is not just the womb. As you can see, the process is happening outside, but they will transfer the baby back into the womb. So the entire body has to be prepared, primed for getting pregnant. And then the body has to be able to go through the pregnancy process. There are people who do succeed with the IVF, and along the line, unfortunately, they miscarry. Sometimes it can be due to inadequate preparation. Sometimes it can be due to inadequate preparation. So it's important to prepare properly and adequately before going for this procedure. Prepare the body. You want to look at how to prepare the body. Very crucial, very important. You must understand that the procedure is beyond the lab and medication and procedures. Okay? Your body is the host to all that will happen and should be ready and able to accommodate all the steps. How do we prepare the body? 1, healthy diet. Never rush into IVF. I want to say that again. Before you begin the process, at least 3 months before you begin, at least 3 months, okay, you must equip the body with adequate nutrition to empower it to go through the process. You need good food, you need healthy diet, you need all the nutrients that your body can get for the entire body to be ready for the pregnancy process. Eat balanced diet. Focus on essential minerals and vitamins crucial to the functioning of the reproductive system. Okay? Get adequate nutrition to empower the body to go through that process. That's the first thing. Way before you, if you have decided that, okay, I want to do IVF, give yourself 3 to 6 months. It might sound funny. I'm sorry to say this. There are some people whom we have advised like this. And they are like, no, this I should do it now. I need to do it because I need to do this after now. I need to do this because I need to do this after the other time. And they just go in like that. And it fails. These things you are saying are not cunningly devised fables. There are things that, see, I tell people that pregnancy is a natural process, but there is a way it must happen. There is a principle that it follows. And if that principle is not in place, you are likely not going to get the result that you want. So healthy diet is so important. Number 2, healthy lifestyle. It's important to emphasize that what you do with your body goes a long way to determine its effectiveness in responding to your procedure. So lifestyle practices like inadequate sleep, drinking alcohol, smoking, taking caffeine like coffee, using illicit drugs like vaping or using hard drugs, all of this can jeopardize success rate. You might say, oh no, this does not affect me, or no, me, I don't do that. But a lot of people will fall short of adequate sleep. Yes. A lot of people will fall short of adequate sleep. So 3 to 6 months before you start your process, start sleeping properly. Proper, adequate sleep is, let me say, 6 to 8 hours of uninterrupted sleep every night. Make sure you have done that for like 3 months before going to begin your procedure. Make sure that you have a normal, healthy BMI. Your body weight is in place. Make sure you are exercising well and keeping fit. Okay? These are healthy lifestyle that you can incorporate to ensure that your body is well prepared for IVF. 3rd point, stress management. Very essential to understand that you need to manage stress for a balanced system. Get sufficient sunlight, as funny as it sounds. These are the things that help to put stress at bay. The long and short about stress is not allowing cortisol level to rise in your body. And the ways to do that are, number 1 is to sleep properly. Another one is to get sufficient sunlight. Another one is to manage your emotions, okay? And then keep busy, have an active life, not excessively stressful, but active, okay? And you keep your body free from ailments, underlying, or if you have any underlying condition, You want to make sure that at that point you're managing it properly. Okay, so make sure that stress is at a minimum before you go for the procedure. Manage your emotions. That is so important. Make sure that you are mentally and psychologically ready, not under pressure of, hey, will it work? What if it doesn't work? Hey, what will I do this morning? If you're at that point, don't go until you are calm. Then you can go for your procedure. Then the next one is the use of supplements. You can not overemphasize this. It is necessary to supply the body with what it may not get from diet alone. And it is almost impossible to get everything from diet. That's the truth. So it's important to take note of this before commencing your process. Then number 5, detoxification after supplement or before. It's important to help your body to get rid of toxic substances that may interact with the medication that you are given from the hospital, and then prevent them from achieving maximum results. This you can do by the process of detoxification. There are different ways to detoxify. If you go through a counseling process or program, you will understand better. We can't talk about all of them now, but it's important to detoxify, help your body to get rid of free radicals and other substances that may interact with the medications you are receiving from your process. You can also ensure that your body is detoxified by reducing or stopping exposure to chemicals from some of the daily products we use and metals. There are some body products from soap, cream, perfumes, and all of that, to wearing of jewelry. All of that is exposing our body to chemicals. And once we have that exposure, what can happen is that our body can be absorbing all of these chemicals. They are also toxins. Okay, these are also toxins that, if they come into the system, can interact with the medications that we are giving and stop them from working maximally. Okay, so before you go for IVF, can you imagine? For some people, this is just all they have missed. Before going for IVF, there are your creams, you should stop some of them. Maybe use basic things like Vaseline or baby oil or baby lotion. That is not, I think there's some baby lotions now that have some chemicals. But basic things, you can even decide to start using kernel oil or shea butter. Just before that, go as natural as possible. That period, don't retouch your hair. Are you seeing what we're talking about? Don't retouch your hair at that time. Make sure you do things as natural as possible, at least 3 months before you go for the procedure, so that your entire system is free from toxic substances. Eat right, okay? Use supplements, but most importantly, at that time, don't wear a lot of jewelry 3 months before the time. See how funny this sounds, but these are the little things that can contribute to succeeding in the procedure. Okay, so that's the end of preparing the body. We said that there are 3 ways to get results. Number 1, plan properly. Number 2, prepare the body, and we mentioned about 5 ways to prepare the body. And then number 3, manage your expectations. Play out all the possible scenarios and prepare adequately. Well, you are hoping for a success, you are planning for it. See, asking the hospital, and it's part of your preparations, asking the hospital that if this does not end in a positive test strip, as in pregnancy is not positive, what can happen? What is the hospital's protocol? Then they might tell you that, okay, they can do a second procedure, and in that second procedure, you will now pay so and so amount of money, like it's way less than the first money you paid, of course. And some people say they do it up to 2 times. They give a couple up to 3 chances under that package, before you can now start again. And when you have all that in mind, your mind is open, and that removes tension, as it were. The reason why you must settle this in your mind is that you understand, okay, that this procedure, however it goes, doesn't mean you have failed. It doesn't put a stamp to your fertility and say, because this IVF procedure failed, I can never be a mother again, I can never get pregnant again. No. Okay, so that first try may not lead to a positive pregnancy strip, but you can follow the hospital's procedure and then or protocol and do a second attempt. And because your mind is open, you might get it at the second try, you might get it at the third try. But whatever it is, if you are determined that you are ready to get pregnant, you can keep at it until it comes. I've seen people who it was on their fourth try they got pregnant. Yes, it's capital intensive, yes, but that's what the planning is about. There is no successful thing you plan and plan only plan A. That would not be wise. You must have a plan B, plan C, just in case, because you are a human being, you're not God. So I hope that makes sense, that we prepare adequately and manage our expectations. When our expectations are managed, we will not be shocked, we will not be disappointed, we will not have surprises. You will not be disappointed, you will not be angry at God and say, God, upon all my prayer, upon all my, maybe I sowed seed, why did you disappoint me? No, it's possible that God has answered your prayer, but maybe something in the physical did not allow it to manifest at that time. It doesn't mean the prayer was not answered. I don't know if you get this. If you pray and believe and have faith, God probably has answered your prayer. But just that the test strip did not show positive, especially if you have gotten a word from God telling you that, go, I'm with you, you will succeed. And then a test strip says negative. Does that mean God has lied or failed? No, it doesn't mean that. It doesn't mean that. It just means that at that point, what you are seeing is negative. And that might be a tactic of the devil to even try your faith. If you really prepared with God, if you really prayed, if you were led to go for that procedure, if you are aligned to God's will to go for that procedure, a negative strip will not make you give up hope and say, God has failed me. No, no. You will only say, well, something went wrong, but I already have a word that I will succeed in this. That gives you the encouragement to do it again. I don't know if somebody is getting me, but this is so true and so real. And if we are able to appropriate this, we'll find out that a lot of us will have more successes than we're already having. Some people just do once and they are so frustrated, so disappointed, so angry at God, angry at the hospital. Anything could have gone wrong. Unfortunately, it might even be from your own end if you don't know. So it's important to take a step back. If the at the end of the fifth stage, we have a negative test strip, it's just to take a look at everything again and say, what could I have done better? The first place to start from is from your preparation. Don't immediately attack the hospital. From preparation, is there any way I didn't get it right? And put that in place and go again, knowing that you have a backend, probably that God has told you, don't worry, go. God will not just suddenly lie because the results is negative. No, the results, God's word is still true. Bible says, let God be true and every man a liar. So you now move on saying, I already have this result. I already have this result. Something just didn't fall in place. Let's try it again. And you go a second or even a third time. But because you have a settled reality that this is going to work, it works for you. The truth is that IVF should never fail. Truthfully, IVF should never fail. I mean, you have achieved the baby already. The baby is transferred into the womb. The womb, before the doctor transfers it, the doctor has checked that everything in the womb is okay if you go to a good facility. The doctor has checked that everything in this womb is okay to accept this baby. Under normal circumstances, it should not fail. Please don't start thinking automatically that if it did not fail, it's an attack. Because We Nigerians, we love to, let me not use that word. It doesn't necessarily mean it's an attack. It could just be that something did not go right. And what are the things that can go wrong? What are the things that can go wrong during IVF? We want to see them. Why IVF fails? Number one, inadequate preparation. This, for me, is the major reason why IVF fails. It is the major reason as far as I am concerned. It is the major reason why IVF can fail. Okay? If you are not properly prepared, it can fail. We have talked about the preparation. I'll post these slides on the WhatsApp group so that you can look at them again and know where you probably haven't gotten it right. Or if you are yet to begin, if you have gotten a failed procedure, check that preparation part, whether you did everything properly, and listen to what I have said again. IVF really shouldn't fail. It fails when, for a lot of time, there is inadequate preparation. Secondly, it could be due to poor medical technique. Now, by poor medical technique doesn't necessarily mean that the facility is bad. It could be that the facility is substandardized, one. It could be that the drugs that they have used is not at their best, okay? Maybe the drug is already about to expire, the potency has reduced, and then they just use it because of cost and all of that. That can be a factor, okay? It could be little things, incubation period, and there was power outage for some time. All those little things can make something to go wrong, okay? That incubation period, when they keep the baby to form before transferring into the womb, is a very crucial period. There are some facilities that maybe because of inability to sustain power, there could be power outages for a few moments, and that can impact on the quality of the embryo. And by the time they are transferring it, because the quality of the embryo is already poor, it might not survive the implantation process. That's a possibility. That's part of medical technique. Okay, so those are factors to look at. Quite right. And there's almost nothing anybody can do about that. But what's your contribution is to do your best to choose the very best facility. And that's why we are here, to direct you and give you good referrals where you can go to and get the best possible care. Final thing that can make IVF fail, human factor. Human factor can be from something going wrong from what a person was supposed to do, still at the level of the medical team. Something could have gone wrong by somebody's mistake, and then along the line, it affects the procedure and it comes out negative. Like I said, anything could have happened. When you don't get the exact results that you wanted to get, sit back, look at it again, try again, and sooner than later, especially if you have it as an absolute way, that's your reason, your indication for IVF is an absolute indication. If you have it as an absolute indication, then you shouldn't just give up. You should try. But if you have tried and it didn't work, then you might think of exploring other pathways to pregnancy, like surrogacy and adoption. And one way or the other, if you keep at it, pregnancy is definitely around the corner. Thank you very much. This is where we will end our training for today, our seminar for today. We hope you were able to learn something. The chat box is open. You can, if you look at the lower right of your screen, you see a message icon. Click on it. You can type in messages there. If you have questions to ask, you can send in your question on the WhatsApp platform. Okay, you can send in your messages or your questions on the WhatsApp platform, and then we will take them. But for now, for all of you who are hearing me, you can just give a reaction, a thumbs up, a hi, whatever. Thank you, Kezi. Thank you, Charity. Thank you, thank you, thank you, thank you, thank you, thank you, thank you. Thank you very much. Thank you very much. Yes. Someone is raising their hand. You want to ask a question, you can type it in the chat box or yeah. Okay, so I have two questions from the WhatsApp platform. I'll just ask. Good evening. Please, for those that have decided on IVF, how does this facility help? Do you have a fertility center that we can walk into and start the process? Yes, we are in partnership with a few fertility centers. Okay, we are in partnership with a few fertility centers. And when you come to us, we'll first of all encourage you to go through our fertility counseling program. Then we will expand the preparation techniques that we have mentioned here to you, depending on your unique situation, and then refer you to the best place to get care for you with respect to your geography and all of that. And when you have done that, you'll be sure to get a good outcome. So yes, that's how we ask. Bookie wants to ask a question. Your hand is raised. Please send in your question. Yes. Okay, somebody said, I would appreciate if the video can be saved or the link should be on for some of us that couldn't join due to some personal reasons. Okay, yes, we are recording it right now. We have the voice notes. Later you can view the video to watch it. Yes. So we are waiting for questions. And reactions, please. So thank you for your comments and your reactions. We are grateful for those that have asked questions. Thank you very much. In the absence of any question, we are going to end the video now, but we will leave the WhatsApp platform open for questions until 8 p.m. before we close it. So if you have questions, please ask. If you have questions, you can send in your questions now. We will leave the WhatsApp platform open till 8 p.m. where we'll take in. Then after 8 p.m., we'll just maybe close the platform to prevent, unwanted messages. And then we can answer all the questions that come later tonight or tomorrow morning. Thank you, Florence. Thank you for being part of it and for participating and listening and hopefully learning something as well. God bless you. Thank you all. Please remember the aim of all we are doing is that so that you learn to teach others. You learn to teach others. The information is not just for you. We might not be able to reach everybody. We will encourage you to invite people to join the group so that they can learn for themselves. But for those who cannot join, at any given point in time, in church, in a social group, in a gathering, you hear women talking about it in the market, contribute with the knowledge that you have gotten and help people to know the right thing. For those of you who have been referring people to us, we are grateful and we thank you. And whatever rewards we are getting, know that you are also included in that rewards. So from all of us here at Love Foundation, I want to say a very big thank you for staying with us. God bless you. Keep learning, keep growing. Baby dust to all of us waiting. In Jesus' name, amen. So good night and have a wonderful week ahead. Bye-bye, everybody. Stop.